Hello, and thank you for joining our town hall session for 2025. My name is Donna Hefner. I'm the president and CEO. The goal of today's town hall is to share information and bring you up to date in regards to the occurrences happening in the district. Also, you recently completed a survey and gave us valuable insight into the questions that you have impacting our future. So today's session, I will hope to answer some of those questions and give you an outlook into our future for 2025. In this update, I will be covering several key areas you asked about: our financial outlook, our future growth and value of our services, our leadership communication and professional development, employee benefits, staffing, parking, and I'll finish with strategic goals. Let's start where we stand in regards to our financial outlook. We have been presenting to the board on a monthly basis in regards to our income statement and the key drivers to our success. We are making improvement. This year we had budgeted for a loss in operations, and we are doing better than we had projected. We are still experiencing a loss from operations, but at the surplus line, we actually are doing better than we expected. So we have made significant improvements. Last year, you might remember that we were on a path of not making our debt service coverage related to our bond covenants. And I'm happy to report that this year we're in really good standing and we're meeting all metrics and key drivers related to our Fitch rating. And we'll be going through that analysis with Fitch here in a couple months. One of the things that I will report is that we have been doing a lot of work around is our staffing cost as a percentage of total operating revenue. This is also a key driver for us, and we have a targeted of 55%. And year to date, we are at 56.8% and doing very well in this area. So great work to all of you. The financial outlook here at Sierra View have really been driven by our focus on staffing cost, as well as other controllable costs such as supplies and professional services and purchase services. So we've been doing a lot of work around contract management as well. As you know, we have new leadership in our financial division. Craig McDonald, who joined us earlier last year as our new CFO. We have a new director of financial planning and revenue cycle, Roger Larson, and a controller who recently has started with us. As we continue to focus on our management and leadership, we also have been working on helping our provider groups. We last year recently changed our ED provider group, as well as been opening up our new maternal child health services for our laborists, as well as our outpatient services in the medical office building. So a lot of work around helping them on board and helping those two programs be successful in that transition. We also had experienced a national shortage in IV fluids, and a lot of work went into making sure all of our patients had the right amount of fluids, and a lot of work from all of you to help us come up with that plan. And a big thanks to Dr. Brassfield, our director of pharmacy, as well as materials management, in helping us procure all those IV fluids for us. So we've also recently been expanding our 340B program. We recently published this in our annual report. That is the 340B program allows us to purchase drugs at cost, and it really helps benefit our community of to the amount of $4 million that we actually recognized as a savings for us by having a 340B program. So those are some of the things. A lot of work also went into managing length of stay. I think many of you have heard me say that our average length of stay target is around 3.8, and we actually have made significant improvements by the efforts of our Director of Social Services and Care Integration, working with the team in regards to the 7 days a week rounding and really focusing on those discharge needs and really making that length of stay come down to from a 4.5 to actually 3.78, and that has significant savings with us as well. Some of the questions that you had, it was in regards to pay equity. And this is something that we take into consideration every year. We go through the process of actually taking every position in the organization and evaluating the salary grade compared to the position in our peer group. And as a result of that, we make recommendations that get proposed in the budget and that will go to the board in June. And that's called our salary administration, where we actually evaluate pay equity. And we look at the positions based on that comparison and make recommendations for advancement of those salaries. Many questions were asked around bonuses, and I will say that senior team is currently looking at the bonus merit increase structure, and we will be looking at rolling that out in the fall. The next section I'd like to cover is leadership communication. Leadership changes can impact everybody in the workplace, and we like to make sure everybody is announced of various new leaders that have joined us, and we use our employee weekly news email as well as our leadership biweekly email. That is one point of contact. Another new leaders are also introduced through the Viewpoint, which once they are settled in, we help them get introduced to other individuals. Department changes with senior leadership, I refer to this as the org chart. So when an org chart change is made, I send that out to leadership and we announce all the changes that have taken place and allow for that information to be communicated out to you through huddles, so you're aware. Another question was around our Education Assisted program. This is a program we've had in place for many, many years. I encourage all of you to take advantage of it. It does help offset some of your tuition cost, and if eligible, you would actually have funds available to you annually. There is a cap on those funds, but I encourage you to use the policy library. It really lays out the steps you need to take, the application you'd submit, and who you'd submit it to is our education department. So great opportunity for all full-time employees regarding this program. The next section we'll talk about is employee benefits. I'm very proud of the benefits we offer our employees. We consider them unmatched. Some of the items that we talk about in benefits are our retirement match, which we have completely funded through COVID and continue to fund every quarter. Myself and other members of the senior team meet with Empower as well as an investment advisor and evaluate the benefit options available to you to ensure that your money is working hard for you for your future and continues to be invested in strong, reliable options. The second benefit that we would like to talk about is the health insurance. One of the things that came up in the questions was our work with Key Medical. They're considered a third-party administrator, and they process and approve the claims for United Healthcare, which is our insurance carrier. So Doug Richardson, who many of you know, recently met with Key Medical and the leadership of Key Medical to talk about some of the challenges that our employees have been experiencing. So more to come in regards to that discussion, and I am happy that Craig McDonald has been also joining that effort in having open communications and really expressing on behalf of our employees what some of the challenges are. So please keep us updated through Human Resources, and we look forward to working through some of those issues with you. One question that was asked frequently was in regards to life insurance. If you participate in our retirement program, there is a $10,000 employer paid life insurance policy with additional supplemental coverage options available to you, your spouse, and children. This is always available through the open enrollment period, which will be coming in the fall. So be on the lookout. If you have questions leading up to that enrollment period, please reach out to Human Resources for that information. The next topic I'd like to cover is in regards to staffing. Staffing continues to improve across the organization. I am happy to report that from last year, we actually had over 120 open positions, and as of most recently, we have only 20 open positions. So what I'm most proud of is our retention of our staff. It is improving. Again, we really want to encourage you to network, and we want to encourage individuals to help us reach that greater than 5-year percentage. Our goal is to have 50% of our workforce here greater than 5 years. So we're inching closer, but quite not at our target. Another priority is supporting our teams and caring for our community. Obviously, hiring is a very important decision, and we don't take that lightly. And so we have many applicants applying for the one job, and we're taking our time to really review those applicants and really hire for the right fit for our culture, and so that we can get them started with us. One of the things that we actually implemented last year, took quite a bit of time, was the change from our payroll system and timekeeping system, which is Kronos, used to be Kronos, and now we've migrated to UKG. So I hope you're enjoying the app. I know I am, and utilizing that to ensuring that every pay period you're reviewing all your punches and getting your time card signed off, because I'm counting on you to do that part, so that we can really make sure our payroll is effective and streamlined, and you're getting paid on time. So just wanted to ask for your help on that. The next topic I'd like to cover is parking. So a year ago, we actually started eliciting feedback from our customers. And one of the things that we noticed that we were not quite meeting the mark on was our patients and visitors being not so satisfied with parking. So I asked myself, how could that be, given how many parking spots that we have, and what could we do to improve parking? So as a result of that perspective and eliciting that feedback, we formed a work group. And the work group started looking at signage, just actual where the locations of parking, the amount of parking spaces related to the entrances of our point of care. And so as a result of that, the work group came up with recommendations. And from there, there was signage changes, there's designated parking spots that need to be revamped. And we know we're underway in a parking resurfacing project that is close to being completed. I heard most recently it completed the design and architectural approval. So we will be in the near future launching our parking resurfacing project, which will also enhance the campus and just the striping and the ease of parking and just helping individuals. So from that perspective, the board did approve just last night, which was the April board meeting, in regards to approving the policy, and those policy changes are going to be rolled out to you in regards to employees parking in designated parking spots here on the main campus, as well as the off-campus sites. It's very important for our patients and visitors who are visiting us to be able to have accessible access to our services on the campus. So I am actually making a point to consider all stakeholders and actually communicating to them as well, that it will include our residents, as well as our physicians, as well as our volunteers and our clergy. So just wanted to let you know the policy will be available. It will be on our e-learning. And if you have any questions, we actually ask that you please bring those forward. The visitor parking is reserved for patients and families. Security monitors will be monitoring regularly in regards to any violations in our parking policy. So just so you're aware, there will be a warning that after one warning, we will be subject to notice of corrective action. So start practicing now in regards to finding your favorite parking spot and And if you need parking after hours, I can test. I use security to escort me out and take advantage of that. That you can reach them at 791-4776 or 791-2273. So put that number in your phone, and if you need an escort, feel free to use them for your safety. The second to the last topic is strategic goals. I wanted to share with you, many of you know we changed our vision last year through the approval of the strategic plan. So our new vision statement is to be the preferred choice for healthcare by providing excellent, patient-centered care through engaged and caring employees and physicians and academic training and timely access to care. So I really believe that vision really leads us to the next discussion around what are our goals for 2025. So I shape them in this regard, in regards to 4 goals. Our 4 goals here are to provide excellent patient-centered care, provide accessible patient-centered care. So that is goal number 1, provide the excellent, accessible patient-centered care. Number 2 is to attract, engage, and train our workforce. And we want to have an excellent workforce, so we have to invest in that training. Number 3, we want to grow our services. And by doing so, we want to ensure our community can continue to access care. Providers and clinics and services that we offer here is an important part of why we exist. And we need to be here for our community with those services. And the last is to strengthen our financial health to ensure the long-term viability of our organization and the services that we offer. So how can you help? Under each one of these goals are key drivers and things that as leadership we're working to attain. I've mentioned a few of those in the financial discussion, but really your help in regards to hospitality, around greeting individuals, focusing on patient-centered care, those are all things that every one of us can be doing every day to make a difference. And as we hear testimonies from our community and from our patients, we're hearing very positive feedback in regards to how proud they are to get the care that they receive here at Sierra View. So great work, keep it up, and we're gonna even propel us even brighter into the future. I will say our stretch goal is to be a 4-star in patient experience. So I think we can do it. We're at a 3-star. We've been at a 3-star for a while, but we can do it. We can get to that 4-star in the next couple of years. We also improved our CMS star rating, and we moved up to a 2-star. So moving that quality indicator as well. So those are all great progress towards reaching some of these goals. Our last topic is culture. We have many fun activities happening this week for Hospital Week, starting Tuesday, Wednesday, and Thursday. We have a picnic, breakfast, various Price is Right games, as well as lunch and dessert. So please come out, join us. Joining us on Thursday is our day is sponsored by our ARC, which is our Awards and Recognition Committee. This committee has been instrumental in helping spread the little sunshine through our organization. They surprised us with National Hot Chocolate Day. They've been providing Employee Appreciation Day gifts as well. So a lot of work has been going into the committee, and we want to thank our ARC committee for all their work in helping us celebrate our milestones and just actually recognize us for our hard work. Also wanted to share with you our coffee and coworkers. Thank you for all of those that have been coming out, playing games with us, and actually grabbing a cup of coffee. Just wanted to let you know that our next coffee and coworkers is July. So make sure you come out in July, and we'll see you at the courtyard for that activity. So as we think about culture, what comes to mind? I've asked that question in leadership of what culture means to you. For me, culture means the way we treat one another. It's the way in which people help us and make us feel good about what we're doing, the teamwork, the communication, and the culture starts within us. And as we show up every day and the way we treat our patients, the way we treat our coworkers, it's what makes the difference. It makes us, sets us apart from others. So I was most recently asked, what are we most proud about? Our culture. And I'm most proud about how we work through difficult and challenging topics. And once we resolve the issue, we take the time to reflect and appreciate one another of how we work through things. And that really is what culture means to me. I will say, when I was asked what is unique about Sierra View's culture, is that it's palpable. When you walk in, many will say that they can feel the friendliness, they can feel the warmth, and they can feel the reassurance that they're going to be taken care of and their needs are going to be addressed. So continue to foster this culture of compassion and fostering our values. And I think our culture will continue to thrive and we will continue to be stronger. In closing, I just want to say thank you for joining in and thank you for completing the online survey. Your feedback means so much to me and to our team in regards to how we move forward in the direction that we're moving. I can tell you am I am very committed to our services and our team that we're at the work that we're doing here for our community. We have some challenges ahead. I won't deny, but based on what I've seen the last couple of years, I know we're moving in the right direction. So we will continue to keep you updated as we move along. Enjoy your hospital week. And it's just a time for us to appreciate you and for all your hard work. It's one of my favorite weeks of the year. And I'm so happy to be able to celebrate with you. So thank you and have a great day and a great week.